Welcome to The Explainer. Today, we're diving into a huge challenge in the world of medicine. How on earth do we make sense of the constant flood of new research? We're going to look at a paper that offers a really powerful way forward. And you know what? It all boils down to one simple idea: finding the right tool for the right job.
I mean, really think about it. Every single day, you see a new headline about some breakthrough study or a miracle cure. It's just completely overwhelming. So how do the experts, the doctors, the people making policy, how do they cut through all that noise and figure out what's actually real? Well, they use this incredible tool called a systematic review. The paper we're digging into today calls it the pillar of evidence-based healthcare, and for good reason. It's this incredibly rigorous, totally transparent way to gather all the research on one topic and then figure out what it all means when you put it together. But, and this is a big but, there's a catch. This so-called gold standard has a problem. As systematic reviews have gotten more popular, they've also become way more complicated, which ironically creates a whole new mess for the very people they're supposed to be helping. The authors of our paper just hit the nail on the head here. They say this proliferation of review types causes great confusion. And that is a huge deal. I mean, if even the seasoned experts are getting confused, what chance do the rest of us have?
So what's the fix? Well, according to this paper, the key isn't buried somewhere in the final data analysis. Nope. It's all about how you start. It's all about the question you ask.
And this right here is the core idea of the whole thing. Asking the right question is everything. It's the first domino that knocks over all the others. The question you start with literally determines what you look for, how you look for it, and of course, what you end up finding. Now, to make sure they're asking those killer questions, researchers use these handy little things called mnemonics. You can see some of them here. And listen, they're not just fancy acronyms to make things sound complicated. They're more like a recipe for a perfect research question, making sure it's focused, specific, and something you can actually answer. So, how does this all fit together? Well, the paper proposes a brilliant solution: a map. A clear, easy-to-follow map of 10 different kinds of systematic reviews, with each one specifically designed to answer a very particular type of question.
And here's that map in action. This table lays it all out. It shows you exactly which review type to use for which kind of question. For researchers, this is an absolute game changer. It makes it crystal clear that you've got a whole toolkit of different reviews to choose from.
Okay, let's look at a quick example. Let's say you want to know if a new drug works. You'd use a PICO question. But what if you want to understand what it's actually like for a patient living with a disease? That's a completely different kind of question, right? So you need a totally different framework. PICO. It's all about matching the tool to the task.
And that's the whole point. Trying to answer a question about someone's experience with a tool designed to measure effectiveness, it's like trying to measure the temperature with a ruler. It just doesn't work. You've got to use the right tool for the job. And just so you know, this isn't just some random idea somebody cooked up. This whole framework was published in a major medical research journal. That means it's been through the ringer, vetted by experts, and is taken really seriously by the entire research community.
So why are we obsessing over all this structure? Because this level of rigor is what makes a systematic review so incredibly powerful. It's the difference between a carefully built, rock-solid argument and just, a random collection of opinions you might find in a simple literature review. Yeah, a real systematic review isn't just a quick Google search. It is a painstaking process with very clear rules. You have to lay out your goals up front, search for all the relevant studies, not just the ones you like, check the quality of every single one, and be totally transparent about how you did it all. And the stakes for getting this right are unbelievably high. To give you a sense of just how massive this challenge is, I want you to hold one number in your head: 75. That's how many new clinical trials get published every single day. We're not looking for a needle in a haystack anymore. We're facing an entire ocean of haystacks. And that is exactly why we need these rigorous, well-defined reviews to help us navigate it all. Because without this kind of rigor, we get what one researcher calls a mass production of reviews that are unnecessary, misleading, and conflicted. And that's not just some academic problem. This can lead to bad medical advice, bad health policies, and at the end of the day, it can actually harm patients. So what's the bottom line here? Look, in the world we live in, we are all drowning in information. And as this paper shows so clearly, knowing how to ask the right question isn't just a skill for scientists anymore. It's a survival skill for anyone who wants to find the truth. It's the compass that helps us all navigate the noise.